Hello everybody, this is Dr.Gita Mathai and this is my Health Vibes channel. Today we are going to talk about bleeding in women. Women are at a disadvantage when it comes to their life and men because they bleed every month and they lose blood and their hemoglobin tends to drop. Most of the time the diet they take is insufficient to make up for this. Finally, what happens? 55% of the Indian women are anemic, which means that their hemoglobin is less than 12 grams, and because of this they are tired, fatigued, they cannot do their work, and women who are very efficient and very fast in completing their tasks no longer can cope and want to take rest all the time. What happens is that when a girl matures any time between the ages of 9 and 15, she is supposed to menstruate every month. Now, sometimes the girls continue to menstruate during the first period itself for months on end, or that is called polymenorrhagia, or else they get periods every 10 to 15 days, and finally after 3 or 4 months they become anemic. The unfortunate thing is that this is not taken seriously, even when it happens in older women who have children and are in their 30s or 40s. Neighbors and well-wishers will say, oh, this is nothing, you just eat a few dates or go to the nearest medical shop and take a pint of glucose, your fatigue will go away, your tiredness will go away and the bleeding will stop. This is not the case. The bleeding, if it occurs like this, has to be investigated. In a young girl, it may be because she has a congenital bleeding disorder which does not allow her blood to stop bleeding, and nobody recognized it until now. It may be because of imbalance of the hormones, because her cycles are anovulatory and are occurring without the ovum being released. It may be because there's a very strong family history of diabetes and she's developing early PCOD. Very rarely it may be due to thyroid disorders, or there may be some congenital abnormality in the genital tract, tumors or something else. The same holds good for older women who suddenly start to have excessive bleeding or bleed more than once in 28 days. Now, how do you know that a lady has excessive bleeding? She may have to change her pads or tampons every 1 hour, or the bleeding may be prolonged for more than 7 days. Please take all this seriously and go to a doctor and have the investigations done. It is not a question of drinking an iron tonic or drinking an Ayurvedic tonic or eating some green leaves and hoping that the bleeding will cure itself. If the hemoglobin keeps dropping because of the continuous blood loss, it can be dangerous to life. If it falls below 6 grams, then a blood transfusion has got to be given. The woman has to be examined and then an ultrasound scan or CT scan, hysterosalpingogram, hormonal tests. These all have to be done to find the cause of this excessive bleeding. Once the cause is found, then that should be treated. It is not it is not a case of going to a shop and buying a shirt. One size does not fit everybody and one treatment does not work for everybody. Please realize that continuous blood loss will make you anemic, will make you tired and will make you sick, and please take this seriously even in young girls. Thank you. This is Dr. Gita Mathai signing off. This is my Health Vibes channel. If you like what you heard, please subscribe to my channel and press the bell button. The same content is available in Tamil. Thank you.